All right, here is some of my knowledge. Okay, calcaneus bone, medial plantar nerve in the sole of the foot. That's the tibial nerve, comes down the shin, down the tibia, past the tibia anterioris, and it comes out through the sole of the foot. And like the roots of trees, feeds the muscles that flex the foot into plantar flexion. Okay, here is some dorsiflexion. In your foot, you've got talus bones, calcaneus bones. You have metatarsals, tarsals, and phalanges. The sole of the foot is covered in muscles like flexor hallucis brevis. Too many muscles really to actually memorize. There's 3 points of your foot touching the floor at any one time. Usually calcaneus, the muscle of the great toe, and the outside part of your foot. Most people don't put the weight through the whole foot, which they should. Okay, tibia anterioris, like I said, and you've got gastrocnemius and soleus. Gastrocnemius and soleus muscles. One is biaxial, crossing 2 joints. One is uniaxial, so it's only attached to the calcaneus bone and only flexes the foot. So it only plantar flexes the foot. Okay, so you've got 2 lobes of your gastrocnemius, and your sciatic nerve runs the length of your leg. Your sciatic nerve is as thick as a pencil. It crosses underneath gluteus minimus and your piriformis. Piriformis is a postural muscle, and your gluteus medius and minimus are abducting muscles. Okay, you've got a femoral nerve in the front of the thigh, and then we've got vastus medialis, intermedialis, lateralis, which make up your secondary hip flexors, your quadriceps. Crossing over those, you've also got sartorius and rectus femoris, and that makes up the main bulk of the muscles that cross here. Okay, some of the muscles are biaxial, some are uniaxial. The biaxial muscles cross under the knee onto the tibia, and also up across the greater trochanter and anterior superior iliac spine, and they anchor onto the anterior aspect of the pelvis. So they do hip flexion, extension. Okay, they are in antagonistic opposition to bicep femoris, semimembranosus, temitendinosus, which are your hamstrings. Bicep femoris, okay, is usually tighter towards the distal end here. Okay, there's a short head of the bicep femoris is where most people carry all their tension. Okay, then you've got gluteus maximus, minimus, medius, and tensor fasciae latae. Tensor fasciae latae stabilizes medial forces. So your gluteus maximus, it doesn't just extend your leg out, your hip out like that. Okay, there's a little bit of lateral rotation as well when it contracts. So the tensor fasciae latae is there to try and counteract those lateral forces by stabilizing with a medial force when your gluteal muscle, your gluteus maximus, fires. Okay, sciatic, femoral, so femoral nerve at the front, sciatic nerve at the back. Okay, the tibial nerve, medial plantar nerve, they're all like roots of a tree. Okay, then what have we got? We've got bicep femoris, obviously that's flexion, quadriceps extension, gluteus external rotation, abduction in the upper gluteal, external rotation in that it's extension, but there's a certain degree of force in external rotation when the gluteal muscles fire. Okay, then you've got rectus femoris, superficial muscle on the outside, and external obliques, internal obliques, and transversus abdominis. Transversus abdominis goes from this linea alba round and becomes part of the lumbar fascia or lumbar fascia here. Okay, it works synergistically with your pelvic floor, which is like a hammock of muscle at the bottom of your pelvis. These muscles are consisting of fast twitch and slow twitch fibers. Okay, so that's fibers that are powered by oxygen and fibers that are powered by chemicals. Okay, adenosine triphosphate exploding from a triphosphate into a diphosphate and searching out that third phosphate again so it can become potential energy. Okay, next. All right, you've got things like quadratus lumborum, which are attached to the top of the iliac crest and then onto the 12th rib. This is extension, okay, and slight medial rotation. So anything where if you leant forward and touched your opposite foot, you would be eccentrically activating your quadratus lumborum because it would be having to lengthen and activate. I won't say contract because contract means to shorten. So the muscle fibers are activating as they lengthen. And then you've got erector spinae, either side of the spine, the entire length. This is strips and strips of muscles all the way along the entire length. That is spinal extension, okay, as well as spinal extension. It's also involved in, if it activates on one side, there's this tiny degree of rotation. Things like multifidus, which are diffuse, it's basically fillets along the entire medial aspect of the spine, attached to the medial processes of the spine. Okay, and that's lateral flexion. They also do a lot of isometric holding of the spine. Okay, so you've got posterior processes on the spine, lateral processes on the spine. Most of these are anchor points for these muscles, like multifidus, lateral. Erector spinae is lateral, and it's woven into the posterior aspects of the spinal processes as well. Then you've got muscles like serratus anterior. Serratus anterior is subscapular. There's no bony attachment with the scapula, and you have to use posture to keep the scapula in the correct place. So the posterior aspect of the scapula has got the serratus anterior pulling the distal end of the scapula down. You want to end up with your scapula a straight line between the medial border of the scapula and the center of the spine that's about the width of 3 of your fingers on either side. The distal end of the scapula is drawn down by the serratus anterior. If you did something like what looked like a push-up without any movement in the elbow, without a flex of the elbow, bend in the elbow, then you'll be working your serratus anterior, which might stabilize the scapula at the distal end because that's where it's attached subscapular. Okay, so you've got trapezius lifting your shoulder girdle up. So this is elevation, this is depression. Okay, elevation from, say, picking up a suitcase. Depression is a certain degree of latissimus dorsi pulling down. The latissimus dorsi is attached to the proximal head of the proximal end of the humerus. Okay, so you have the humerus, latissimus dorsi. Latissimus dorsi diffuses into the fascia as well here at the back. Okay, you've got, as I said earlier on, interior. You've got oblique, the interior oblique, the internus, and that is lateral flexion, ipsilateral flexion, okay, rotation, lateral flexion, rotation, okay, and there's a certain degree of compression from the deep transversus and internal obliques if you exhale. Okay, so we've got that hammock of support here. Pectoralis major, pectoralis minor. Pectoralis major is from the sternum out to the distal, the proximal end of the humerus. And then you've got pectoralis minor, which is just outside of the sternum onto the coracoid process. Okay, bicep, you've got median nerve feeds those two fingers, and ulnar nerve feeding those fingers, and then it travels up the back of the arm, behind the elbow, and up into the medial border of the scapula. Bicep is obviously bicepted, it's in two lobes, and it's attached onto the lower arm, and then anterior aspect of the scapula, coracoid process. Okay. Clavicles, and then you've got your pivot joints. That's a unique joint in the human body. Okay, the knee's a hinge joint. You've got synovial ball and socket joints here. The sacroiliac joint is a synovial joint. The wrists are a synovial joint. Gliding, sliding joints in the fingers and hands. Okay, that's carpals, metacarpals, phalanges, again, like the tarsals. That's a saddle joint in your thumb. There's only one muscle in your thumb, and that's this great muscle here. In the saddle joint, the muscles for the fingers that do flexion and extension, they are here in the forearm, okay? And underneath, so you've got finger flexors, finger extensors, tricep, extension of the arm, bicep, flexion of the arm, and they're in reciprocal inhibition, so they are counter muscles of each other. Your shoulder muscles, your anterior deltoid, medial deltoid, posterior deltoid, is in antagonistic opposition to latissimus dorsi. One brings the arms down, one pushes the arms up, or brings the arm forward in extension, out to the sides. And if you were leaning over, the posterior deltoids are retracting the shoulders back. The rhomboid major and minor shorten to retract the medial borders of the scapula. They adduct. Okay, so that's retraction, protraction, elevation, depression. Sternocleidomastoid. With sternocleidomastoid on either side, that's about lateral flexion, rotation. Scalenus muscles. Wherever a muscle is, you can tell what it does. So muscles only pull, freeze, or eccentrically activate. That's lengthen while activating. Okay, so that is my bit of anatomy physiology today. I'm sure there's loads more I could talk about. Thank you very much.